Good evening, and thank you for joining us. I'm Jamie Yukas in for Norah O'Donnell. We begin tonight with a major milestone in the fight against COVID. The FDA has authorized the first antiviral pill to treat the virus, though the White House warns it will not be widely available for months. The milestone comes as U.S. cases, hospitalizations, and deaths are all rising. And now health officials are warning of a possible tsunami of new infections from the Omicron variant that could overwhelm hospitals. The variant has been found in all 50 states, as well as Washington, D.C. and Puerto Rico. And think about this. It has only been 22 days since the first case of Omicron was detected in the U.S. COVID has shut down professional sporting events, Broadway shows, and concert venues. Now, a major college bowl game is in jeopardy following an outbreak among players. All this as millions of Americans crowd airports and plan Christmas gatherings, which could cause the next big surge. We have lots to get to tonight, and CBS's Chen starts us off in New York City. Good evening, Nancy.
Jamie, good evening to you. Here in New York, average new daily COVID cases are up nearly 500% in just 3 weeks. The demand for testing is so great that CityMD, a major healthcare provider here, has temporarily closed nearly 20 locations because of staffing issues.
Pfizer's COVID pill is the first at-home treatment for coronavirus, and it's a promising one. It's aimed for those who are at risk and shown to be nearly 90% effective in preventing hospitalizations and deaths if taken within 5 days of experiencing symptoms.
As quickly as Pfizer gets the pills manufactured and delivered, we will immediately provide them to states and jurisdictions for distribution.
But there are also snags, as 2 of the most common monoclonal antibody treatments that doctors have depended on are unlikely to be effective against Omicron. Israel is now trying to get ahead of the Omicron surge by approving a 4th vaccine dose for those over 60. But even as the Biden administration promises to send out 500 million at-home testing kits, it's not soon enough, with Walmart and Amazon limiting the amount people can buy. There were long lines today outside libraries in the nation's capital for take-home tests. Washington, D.C. is also implementing proof of vaccination requirements for indoor venues like restaurants and bars. California is mandating boosters for all healthcare workers. This as the Omicron variant continues to rise exponentially. The dramatic increase of Omicron in just the past week is seen here, not only taking over as the dominant strain, but creating a surge engulfing the entire Northeast, Midwest, and much of the Southwest. It's also leading to more holiday chaos. Florida's Gator Bowl is the first major New Year's bowl game in jeopardy, as Texas A&M dropped out because of a COVID outbreak. Still up in the air, New York City's ball drop.
I'm going to encourage everybody to be smart. This is an outdoor event. It is something that I don't see a reason why it couldn't go on.
You can take a deep breath for me.
For those on the front lines, new dread.
What is the fear of what could happen?
It's really the unknown. We are in a perfect storm.
Mary Ellen Coaches-Rouliard is the chief nursing officer at Michigan's Beaumont-Dearborn Hospital, where the ICU's capacity remains at 98%, and the U.S. military has deployed a team to help with staffing.
To be here now, it really gets us down. I think if we can get more people vaccinated and with their boosters, that will help us get through this surge, as well as any future surges that come.
And the first federal emergency COVID testing site opened today in New York City. Meantime, some good news from overseas. In South Africa, where the variant was first detected about a month ago, cases are now starting to drop very quickly. But, Jamie, it's still too soon to tell if that will happen here.
Yeah, we hope it does. Nancy, thank you.